Hello everyone, my name is Sudeshna R.RAJASINGAM, metric number 8170055, and today I'll be sharing a little about the impacts of COVID-19 on workplace ergonomics. As we all are well aware, COVID-19, or well known as coronavirus disease, is a new strain of disease that has been affecting the whole wide world and putting all of us into a global pandemic. Due to the occurrence of this global pandemic, there has been many observable changes happening all around the world. It is not only one country or one person affected by this pandemic, it is the whole wide world that is affected by this global pandemic. There has been many changes going through, and some of them are the change in our education system. Children are no more allowed to go to schools. Schools are being closed and the education system has been changed into an online mode. Besides that, our social lives has also been changed. The COVID-19 pandemic has led to a dramatic loss of human lives worldwide, and many other challenges like public health, food system, and also the world of work. The economic and social changes that happened due to this COVID-19 pandemic is also devastating to know. As a change to the world of work, this COVID-19 pandemic has caused millions to adapt the work from home culture. While working remotely can help workers to stay safe from this global pandemic, however, it is leading to many unwanted consequences. In this video, I would like to highlight some of these impacts of workplace ergonomics due to COVID-19. The first impact that I would like to highlight in this video is the increase in musculoskeletal diseases. A perfect example to support this statement is the wearing of gloves among our fellow healthline workers. As we all are aware, since the beginning of this pandemic, healthline sectors has been the most busiest sectors of all. Therefore, they are advised to be wearing gloves at all times while treating their patients. This is because to avoid the spread of the disease from one person to another. Though the wearing of gloves has its advantages, but in long run, the wearing of gloves can actually cause damage to the wrist due to its ergonomic properties. This damage does not only affect physically, but in long run, it can also affect the productivity of the individual in the sector. As we talk about the wearing of gloves and increase in musculoskeletal diseases, another important impact to take into consideration is the increase in health risk among healthcare workers. Healthcare workers, you may think, why is it so? Can we all just take a moment to think, how are the health workers protecting themselves from this disease despite helping us to treat them? Yes, it is the PPE. Personal protective equipment, also known as PPE, is a protective clothing to help prevent the wearer from being infected from diseases. Have you wondered how does it feel wearing the PPE all day? According to International Labour Organization 2020, the heavy usage of PPE unit can cause health risk. This is because the PPE unit covers the whole body, causing heat and sweat being trapped, and this leads to dehydration and stress among the healthcare workers. Next, let's look into the psychosocial effect that has been occurring due to this COVID-19 pandemic. This is a survey from the COVID-19 Risk Outlook 2020. According to this survey, 37% of the adults have been showing signs of psychological distress, while 45% of the adults have been facing the effect of mental health, and 70% of the adults say that this has been the most stressful phase of their entire career life. Psychosocial effect is an important factor to be taken in consideration because ergonomics is all about safety and healthy work environment. A healthy worker always contributes to a productive organization. Besides that, work from home is a roller coaster ride for many. You may think it is not because everyone gets to work in their own comfort zone. For example, an individual gets to work at their home while watching a TV series or even while snacking. However, the answer is a big yes. It is a challenge for many people outside that. This is because many face difficulties to obtain obtain proper equipment to ensure ergonomically home workspace. Work from home is also known to be fatigue. Why is it so? This is because we get to work at our own comfort. Just imagine you sitting in your favorite couch at home and while working. Do you even realize that your movement has been restricted, that you're always sitting on the couch and there is no physical movement like you are in office? Next, repetitive work. Doing the same work over and over again can cause fatigue and boredom in a person. Last but not least, fatigue also happens for people working from home because their social interaction is being limited. If we work in a physical environment, such as an office, we get to meet with our colleagues daily and we get to meet them face to face. Unlike working from home, we only get to meet them through an online platform. And rest of the time, we are always looking at the screen of the laptop or phone doing our work, and this can cause fatigue in an individual. I hope my sharing on the impacts on workplace ergonomics due to COVID-19 pandemic is a beneficial one. We all are aware that this pandemic has been the toughest time for all of us, regardless of age, culture, and where are we from. But remember, we all are in this together and we will come out of this together. Till then, take care and stay safe. Bye bye.